So interestingly, you and I have been kind of doing this work for about 25 years both. And I don't know how much you know of my background, but I started as a craniosacral therapist, massage therapist, got into doing functional movement,
Yeah.
personal training work, and a lot of postural correction work and a lot of pre and postnatal work, which led me into also working with babies. So I've got this sort of wide range of things, but I initially started out my career working with chronic pain.
Yeah.
So, and
Yeah.
I still do quite a bit of that work as well.
Right. Well, it's hard to get away from it. There's so much of it out in the
Right.
world.
Right. So what was your entry into this? You started as a physical therapist, kind of more orthopedic type work, or
Yeah. So, well, I had my own back pain prior to going to PT school.
me
And
too?
yeah.
Same story.
And yeah. I thought, oh, I'm going to learn the insider secrets if I go to PT school.
Right.
So
Right.
that never came. And as you know, my first job as a PT outside of PT school, I mean, I was a miserable failure.
Yep.
Anyone who had pain of more than 3 or 4 months or something, venturing into that chronic range,
Yep.
it was hit or miss whether I could help them.
Yep.
And I felt awful. I actually sunk into a deep depression. I was thinking about leaving physical therapy.
Yep.
And then I ended up moving to Denver and I got a job at a high end health club in downtown Denver. And instantly my schedule filled with people with pain.
Hmm.
And these are people in their 30s, 40s, 50s,
Yep.
well to do, access to all medical practitioners. They could pay for anything.
Yep.
No one could solve their pain. I'm just like,
I
holy
was in
smokes,
same
not
thing for
just
me.
me.
I started in Minneapolis, got a lot of that stuff right away, but then I moved to New York. I was in Brooklyn and I did some work in Manhattan as well. But same thing. I started realizing that a lot of people were just not having success with
Yeah.
with physical therapy a lot of times, or with surgery. If they felt like that was the route. And obviously, there are times when like it's critical, like there's quality of life issues that come up for people where surgery is definitely a
Hmm.
thing. But oftentimes
Sure.
they don't try other things first.
Exactly. And frankly, a lot of them do. I mean, I've owned my own
There's that
clinic
too.
here in Denver for, the past 10 years or, roughly. The people who came to see me were the people who tried everything,
Yeah,
you know,
yeah.
and then their doctor, had heard about me or our clinic or whatever. And so that, and you come in and you have these people who are arms crossed. You're not going to help me. My doctor told me to come here.
Right, right, right.
And we've got to turn this ship around, right? And so, but it was a long, long, arduous road to get to that point where I felt confident that I could help people.
Yep. Well, so what was your back issue? Did you ever figure out what was going on, and what and if you can maybe share what
Oh,
you've
sure.
done to sort of keep it well, because we don't oftentimes when we have these things, there's something going on that's either like we have a precursor for, we've had an injury maybe back in our sports playing days or
Mhm.
something, and then we need to kind of learn ways to manage it. So is there anything you can kind of share about what your story is?
Yeah. Well, first of all, I think it's unreasonable to expect that anyone be completely pain free 100% of the time.
Right.
Right? So while my back pain is 99% in all activities I do, I still have back pain that I think about, because
Yep.
I know if I do something wrong, that back pain will come back.
Yep.
So, but most of the day, I feel no back pain at all. So there wasn't, at that time, I didn't go get an X-ray, I didn't get MRIs or anything like that. I just went to a physical therapist. Initially, he did a couple of things to my back, and it felt great, but then it came back.
Yep.
But intuitively, I've always felt that my pain was my fault. I'm doing something that's
Mm,
causing my pain,
yep.
right? And so that's what guided me and drove me. And frankly, that's the same thing with my all my clients. All of these varieties of types of pain that I'm seeing that people can't seem to resolve, to me, my bias in my thinking is that it must have something to do with how they're using their bodies. I've got to figure
Yep.
this out.
Yep.
And so, and that's ended up being the case with me. too. And so one of the first places I looked was one of my classmates in PT school went on and on about Dr. Shirley Sahrmann. And, she has this textbook called Diagnosis and Treatment of Movement Impairment Syndromes. Just kind of rolls off the tongue. And
Yeah, totally.
so she was a professor at Washington University in St. Louis and had taught there for decades. I took her courses and boom, this was exactly, she had not only the movement aspect of things, but the biomechanical aspect of what's going on too
Yep.
with the movement. And so I took her courses and, lo and behold, my patients started getting better and better. But then, as you know, Jeremy, as you get better, the next tier of patients comes knocking on your door.
Yep.
And so that next tier of patients came and suddenly this information was helping, but not all the way. And so that's when I looked into Thomas Meyer's work with anatomy trains.
Yep.
And
Yep.
his fascia,
Yep.
for those of you who aren't familiar with them. And fascia is connective tissue in the body. And he identified superhighways of fascia that connect our head to our toe.
Yep. Exactly.
And all different aspects, like the back of our body, the front of our body, spiral lines, all sorts of things. Well, his fascial lines identified almost perfectly with Dr. Shirley Sahrmann's 3 primary patterns that contribute to almost all back pain.
Yeah.
I'm just like, well, this can't be a coincidence. She never talked about fascia. He never talked about biomechanics and movement. I'm just like, I've got to put this together. So that helped me see things that were further away from the pain, how those could influence the pain from a fascial perspective.
Yeah.
And then, so people started getting better. But then that next tier came in, and it was as if there was a battery that was supercharging these people's bodies to be locked in these painful movement patterns.
Yeah.
I'm just like, where is this coming from? And that's when I discovered Thomas Hanna's work with Hanna Somatics.
Yeah, and I don't know much about that. So if you could share, that would be great.
Yeah. Well, you're not the only one. I didn't know anything about it either.
Well, I did a quick little bit of research and, just saw he was kind of starting this stuff around the 70s, which was kind of when, Dr. John Upledger started all this work with, craniosacral therapy and tying it to fascia and realizing, there's a bigger global sort of connection with everything going on.
Yeah. So, purportedly, Thomas Hanna was the person who brought Moshe Feldenkrais to the United States.
Okay.
And studied under him. And anyway, after I was very reticent to even study Thomas Hanna's work because, like you said, there's nothing online about it. There's no research about it. There's nothing.
Right.
And in medicine, everything has to be evidence-based, right? So I'm just like, well, but I had a phone call from a person who had read my back pain book, agreed with everything, but she just couldn't solve her back pain. It was like it was locked in this position. She couldn't undo it, even with all the exercises I had given her. She went to a Hanna Somatics practitioner, and in one session, she was 75% better. And she had called me crying. She was actually talking about suicide because she was in such pain. And I talked with her for an hour on the phone. I just couldn't help her. She called back a month later. She said, I'm 100% better. I said, how did you do it? She said, Thomas Hanna's work, Hanna Somatics. So I took the leap and I took the course, which is a very long, arduous, 3 years. Every 6 months you go for 10 days kind of thing. And he identified this identical 3 patterns of dysfunction that Dr. Sahrmann had identified and that were found in Thomas Meyer's work. So here are 3 different researchers coming from 3 different points of view: biomechanics and movement, fascial planes, and then neurological energizing of the body in certain patterns. And I'm just like, this is it. So I put it all together, but none of the 3 of them were really going deeply into what we were doing that was causing these patterns of dysfunction.
Yeah.
And so that's what I've been trying to figure out these past 20 years. And once I put all this together, wow, it was a big game changer.
So can you take me through like what a Hanna Somatics is it a hands-on type of work, I assume? And,
yes.
And what it looks like in terms of treatment?
Sure. You can do hands-on and you can do just like I can guide someone through a Hanna Somatics movement lesson.
Okay.
And they can control their own body. So I don't have to do it. So imagine you're pretty familiar with Thomas Myers' work,
Yep.
I'm guessing,
Yep.
right? Okay, so imagine your Thomas Myers back line, okay? Which is, folks, if you're not familiar with this, I've got a little skeleton here. All the muscles and fascia that start at the top of the head, all in along the back, down to the bottom of the foot, and even the
Yep.
bottom of the foot.
Yep.
It comprises the back line of fascia that Thomas Myers identifies,
Yep.
okay? And the reason that he's calling this, putting all this together is because this can be dissected from the body as one contiguous piece of tissue. Even though it includes fascia and muscle and tendons and ligament, all of that is connected via fascia. So it all works together as one unit in many instances.
Yeah.
All right. So what Thomas Hanna did is his focus is primarily a contract and slow release with a lengthening of the muscle
Okay.
to reset the muscle spindle fiber reflex pattern that all of these muscles are caught in.
Okay.
But he does it for the entire fascial line, not just here in the back or not just here at the neck. It's the whole thing.
So it's a
So
systematic movement, kind of contract
it's
and
a very,
relax type of work.
very much like that. Yeah. And so, anyway, that ended up being the game changer that my patients needed. They needed to be guided into how to release this tension in this whole pattern of dysfunction
Yeah.
neurologically. And then there are, of course, biomechanics that are also feeding that pattern that Dr. Saruman had identified.
Yeah.
And so this is how I've combined all three. And then, of course, how we're using our body is the thing that's locking and activating this whole line of fascia in the first place.
Yeah.
So that's kind of in a nutshell.
And is that something that you kind of have learned to do for yourself with your back pain then? Is that a like in terms of like a, because I know a lot of what you're sort of working on with everything that you're developing with books and video and audio and stuff seems to be kind of self-care or self-treatment based. Is that something that can be taught and then the person you're working with can start to use it?
Yeah, absolutely. In my in the home programs that I've created, I have a section of all just somatic movement lessons. There's 4 hours and there's 8 different lessons that take people through releasing these lines of fascia through their body.
Yeah.
So yeah, and some of them get a little weird, but
I mean,
they work.
My work because I've kind of gone. My referrals now come from, both mental health therapists, so some different kinds of talk therapy. And then also a lot of orthopedic stuff. I do work with pediatrics, so I'm kind of getting it from there. And sometimes there's an orthopedic component, but I also do a lot of work in coordination with like dentists and it can be anything around that area because as I see in your work, you're also dealing with trigeminal nerve issues. Yes. So when it comes to craniosacral therapy, it's most of my listeners have know about this, but basically it's a very low force osteopathic type of work. And really it's a fascial work. I mean, people think because it's so gentle that it kind of falls into the energy work realm, which, I mean, we're always working with energy on some level, right? The body is an energy thing, but what I'm really looking for is kind of an easy way in sometimes, especially with someone who's been in a chronic situation for a long time. And through the pandemic, I've even worked with people who have lost taste and smell, and surprisingly just with craniosacral therapy have gotten that back online, which is you never know with these things. I'll try anything that I within my skill set, but you just never know what's going to happen sometimes. So
absolutely. Yeah, with trigeminal neuralgia, I didn't realize that I could have helped someone like that,
right?
Until I just, like you, sometimes you just have to try it. And that's when I worked, then that's when I kind of worked back to figure out, hey, how did this work?
Right. Exactly. Yep.
Yeah.
So what is do you have a private practice now?
Yeah. So I owned a sports and orthopedic clinic for about 10 years and I sold that in April. And, financially, frankly, I just couldn't make it work anymore. You
To
know,
have a storefront?
yeah,
Yeah.
I just couldn't make it work anymore because our insurance contracts were the same. They were the identical payouts that we were getting 15 years ago,
Right. I know.
and the insurance companies wouldn't negotiate with me,
Yeah.
to raise it, and costs go up, and I just couldn't. The answer to that problem should have been reduce my treatment times, but I
Right.
didn't want to reduce my
I know.
treatment
I
times,
know.
So that's when I decided, you know what, I think I'm going to shift my focus to this online work and make the world my clinic instead of just this one little place.
Yeah, that's
And
good.
so that's where I'm going now.
Yeah, I mean, I had started a place with a couple of partners in Brooklyn, New York called Everyday Athlete, and we basically kind of dealt with all sorts of things. I mean, we kind of thought about everything we do in our lives is on some level has an athletic component to it, whether it's like getting
Hmm.
your kids in and out of the car or whatever it is.
Yeah.
And so but we ended up doing a lot of sport specific training and a lot of body work related to that. And but the storefront aspect of it was really what kind of like we managed until 2008. Of course, everything the world changed. And
Yes.
at that point, a couple of years later, I also moved back to Minneapolis. And at that point, I had people who were interested in having me, become business partners with them and stuff. And I just didn't see the way that the model was going to work that way. And I've been kind of just doing private practice, cash, out of pocket for a
Hmm.
lot of things. And I do some pro bono work as well, just to kind of like balance it out. But that's really the only way that I think, people like us can actually make it or start creating programs and bring it to the world. And that's kind of, for me, the podcast has been that sort of showcasing people like you and people who are actually, delivering the resource in some way.
Yeah. So I didn't realize that this is what I've been working on. Um,
Yeah.
so like I said, when I took Dr. Sarman's courses, I made friends with a PT in one of those courses, and we happened to end on the same course at the same month and year. And so, I went up to him and I said, "Hey, how you doing?" He said, "Great." And I said, "How's this information working for you?" He says, I'm just like, "What are you talking about? This has completely transformed the chronic pain aspect of my practice. I can't believe it." He says, "Yeah, but I'm a manual therapist, so, maybe I'll use this for a home program or something like that." And that's when I realized that uh, our belief systems are filtering out information that could be helping our patients.
Yeah.
And that's when I decided to write my books 10 or 12 years ago, is that I needed to do an end around people who thought who didn't think that movement mattered,
Yeah.
right?
Yeah.
In treating, or they just wanted to stick to the types of movement that we were taught in PT school.
And I actually think it's the most important part. I mean, it's the thing I try to,
Oh
if
yeah.
I get somebody and I'm doing manual, therapy with them to start, my goal is always like getting them to do more and more movement, sometimes, core stabilization, shoulder stabilization type of work to the point where they're just not experiencing the same level of pain, where they can move with more ease, and then starting to work on some of the mobility challenges, and then just start building again from there. And it's amazing. I mean, I work with people sometimes, in their late 70s who go through these major transformations that they thought were all age related things.
Yes. Yeah. You're absolutely right. I mean, we are designed to be movement beings,
Yeah.
and movement connects to our brain, and our brain connects to movement. And gosh, if you're missing out on this, you're missing a big thing. So anyway, that's why I wrote my books 10 years ago. And then, I purchased this clinic, I worked in this, and I streamlined my version of what I was writing about in my books. And I realized that these things just weren't happening randomly in people. They're happening in patterns. And so once I realized that, oh, like for instance, you might have back pain, but someone else might have sciatic pain, and another person might have SI joint pain or hip pain. Oh, but it's all coming from the same pattern of dysfunction.
Right.
So that made treating pain a lot easier and
Yeah.
faster,
Yeah.
because once you recognize the pattern, it's simple to solve. And that's what my home programs are about, is fixing these patterns of dysfunction that are causing almost all of our chronic pain.
So you decided to break this down, I noticed, into different pieces. So you
Mm-hmm.
have one that's kind of on the back, shoulder and elbow stuff, headaches and neck, and then the foot and ankle. So can you maybe walk us through just briefly what kinds of things you put into each of these programs?
Yeah. So it sounds like you're referring to the books or the
The
home
books,
program.
yeah, yeah,
Okay.
and
All right.
that's different than the other program. Sorry.
Yeah. So the books, so initially I had it all in one book and I
Right,
connected everything, right?
right,
And so and I passed it around to a few people and they're just like, this is way I can't, there's no way I'm going to read all of this stuff.
yeah,
So they said, what you need to do is break this up. And so that's when I realized, oh, okay, I'll break it up into how you just described. So what the way it works is, but in the clinic, basically I've divided the body into two exams. One is the back and lower body exam, and one is the pelvis and upper body exam.
okay,
And so that's really simplified how I look at most things. Of course, we can connect foot to head, but most people don't need to connect the foot to the head. Most people can, if we start the pelvis, we're good enough there. If we need to connect, then we can. And
yeah,
I can describe how that is connected. But anyway, that's functionally that's how it works in my clinic. But in my books, I had to break it down even more because someone who has uh, back pain wouldn't buy my back pain book because they have hip pain. Oh, well, I have hip pain, so this doesn't apply to me. Or I have
right,
knee pain, so this doesn't apply to me. Even though most back pain is caused by some problem in the lower body system,
right.
I had to create these different books to appeal to what people were searching for, even though there's a lot of
And there's got to be a
cross
lot of overlap in the books. You
overlap.
have to
Yes,
kind of be
exactly.
talking about all these things.
Exactly. So
Yeah,
that's why I've broken the books up into how they're broken up, but you'll find there's a lot of crossover with that information.
yeah. So when you were when you were working, doing your more hands-on work or training people, did you have kind of I'm always curious about what your assessment, how you do evaluation, whether it's some combination of watching movement happen, do you do hands-on with them and try to get a certain amount of that? Good because for me, I like to do a little bit of both. I oftentimes will actually get people on the table with clothes on and do some very light manual traction work. And just because of the craniosacral experience, in my work, I've been doing it for so long that I can basically, do a little work underneath their heels if they're lying on their back and underneath their head and head and neck area. And I can get a pretty strong sense of what their pattern is. And then, from there, I might make different assessments. Does this feel like it's kind of coming more from their lower extremity? Is the pelvis in rotation? Is there, what's happening at the occiput? Just different pieces where I'm trying to kind of figure out where do I want to start, working. And a lot of times I will I almost always start kind of around the sacrum and around the spinal base, just because I want to kind of see how easily that some mobility can happen around those SI joints, or how well the pelvis can kind of settle. Because as you know, because we are spending so much time in seated positions, those hip flexor muscles tend to get kind of adaptively shortened, and they kind of pull down on the front of the lower spine, which kind of sends us into this whole body shortening that pulls the head and neck forward and all those things. So I like to kind of start around that area for me, but I'm not I'm not always going to start. It really depends on what they're experiencing. But even if they're coming to me for headaches or neck issues, I like to start lower down in the system. I just find a lot of times freeing that stuff up will actually start to elongate things even towards the top of the system.
Mm-hmm. So I think the question is, how do I go about my exam?
So how do you? So sorry. How do you? What's your assessment like? Where in
Sure.
terms of hands-on and watching movement happen?
Yeah, well, there's a little bit of everything, right? Because it all matters. And so the first, I mean, let's narrow it down to a back and lower body assessment
Okay.
first. So, right off the bat, I'm watching them walk to my table, and that gives me a heck of
Yeah.
a lot of
Yeah.
information. And then we go through their history. and I get a sense of their psychological approach to their pain. And so that has a lot, and um, that helps guide me into how I'm going to be working with this person.
Yeah.
And then we start our biomechanical exam. And so, of course, I have them stand in front of me, and I, measure the pelvis, and I just go through I measure for pelvis and rib cage asymmetry, and then I go into measuring, hip flexors, things like that, femoral anteversion, retroversion. I look for anterior femoral glide syndrome. I look at, calf soleus tightness,
Yeah.
whether they have, are their feet pointed forward when they're standing? Do
Yeah.
they have flat feet? Do they have high arches? All sorts of things. So based on what I've seen walking, and then I ask them to walk, of course, again, and what I've heard them saying. I mean, the exam is pretty much the same for everyone. I may do a little bit of one or two things here and there that are a little different because I have a nagging suspicion of something's not quite adding up.
Yeah.
But through that exam, I mean, I'm not only testing the biomechanics and movement of things, but as you know, I'm testing the muscle tension
Right.
and
Yeah.
the neural tension that they've got too. So yeah, and there are lots of easy little clues that I use to drill in on that stuff. So then I put it all into a picture, and this is the reason why I have my little skeleton, is because then I take my skeleton out and I explain to them everything that I see going wrong and why
Yeah.
it's happening to them.
Yeah.
And this is really when the beauty, I feel, happens, because as they watch me explain it, you see the light bulb go off in their minds, like, that's why this is happening. I said, yeah. And they said, oh, that's why that old injury here is probably creating this. I said, that's exactly probably what's going on. So we're going to have to fix that old injury because it's causing this problem now. And so in a nutshell, that's kind of how I do it.
When you say measuring, are you doing actual, like, using a measuring tool, or are you just talking about kind of with your hands and the way that you kind of feel tension? What do you mean
Are
by
you
measuring?
talking about measuring tension?
Yeah, yeah. Like when you're saying
Okay.
you're measuring, the legs, or the, pelvis to rib cage base or something, are you actually
Oh,
using a tool to measure?
oh, well, no, I mean, there's two ways there's more than two ways, but the easiest way and fastest way, first of all, I like to see what they're doing functionally.
Yeah,
So I measure the pelvis as they're standing there. They've just done a little bit of walking,
yeah,
so they haven't done anything to change how they're using their body yet. And this is the other thing, is during my exam, I don't tell the patient anything
yeah. I don't
until the
either.
very end, because I don't want them to change anything about what they're doing.
Yeah,
But anyway, to answer your question, to measure the pelvis, I just put my hands on top of the iliac
right.
crest and see that one is
Yeah,
higher.
yeah.
Same thing with the rib cage. But what people will often find is that changes when people are lying down,
Right.
and so that tells me it's a weight bearing type of issue.
Yeah.
So that's kind of, I can measure specifically with the degree of femoral anteversion and retroversion. I can look at it grossly. You know, it's there are certain components that I must get a direct measurement with, but there are many that I can eyeball and see that are
Yeah.
happening.
Yeah.
Yeah.
Yeah. Because when I was having my back issues in my 20s, I actually had a very rare thing done because I had a friend who was a chiropractor. She brought me to this place that she knew that could do a full body X-ray. And this doesn't happen very often, but I still have these X-rays, which is kind of an amazing thing to have.
Oh yeah.
Now I'm 52, so I've had to take it for different appointments over the years, and every doctor that I've shown it to is just like, oh, this is something. And I've had different people actually do measurements on there, and the interesting thing is I've gotten different measurements from different doctors
Yes.
with the same physical piece of, so
Yes.
it just goes to show how, like, it's, when we're trying to figure out what this balance is, because, for me, I have one really flat foot, one side that doesn't have a great arch, but it's got an arch. And so,
Hmm.
what that has done to me functionally, the way everything is sort of, and that it's a birth defect, and I've had it since I was a kid. So, and I started having to wear orthotics, and they tried figuring out things to do with it back in my teen years, but we weren't quite at that point with orthotics or with how we were sort of, dealing with these kinds of things at that point. No manual therapy or anything else going on. But that information, to be able to have that long term could be of a benefit. But for what you're saying is like seeing somebody standing and seeing how their body sort of how gravity, works on their body, and then seeing it on a table and seeing what happens. Those two assessment tools are pretty huge in terms of what we can get from that kind of information and then deliver it back to them at the end and start coming up with some kind of a protocol.
Yeah, and this is the beauty about what I've developed in terms of my assessment approach is that I'll identify pretty much everything that is contributing to their pain,
Yeah.
and I've kind of created a prioritization of what that is, but I'm willing to be wrong on that prioritization.
Hmm.
So, but interestingly, about your full body X-ray, I have a new book that's coming out early next year too, and in it I have a story about a mother who brought in a not a full body but up to the rib cage X-ray of her
Hmm.
daughter to prove that she had a leg length discrepancy, and she
Yeah.
absolutely did not have a leg length
Right.
discrepancy. We corrected it there, and which immediately improved this little girl's balance and proprioception. Uh, and you know, I think leg length discrepancy is one of the biggest myths in medicine,
Yeah.
and I don't think there's a standardized. I mean, I've standardized my way of measuring leg length, but it doesn't appear to be the same with everyone, and I think it should be because I think there's a lot of people thinking that they have a leg length discrepancy out there that don't.
I was told I had an inch and a half difference,
Mm-hmm.
and my calcaneus, my heel bone is a little rotated, and so that does drop things down a little further. So there's something there, and but when you look at it on an X-ray and try to measure it, we can't tell exactly, is the pelvis slightly rotated back? That could be part of the
Sure.
measurement. And as we know, like functionally, the body does makes all sorts of adjustments over time. So even if we do have some leg length discrepancy, I don't think that is always the biggest thing, because they immediately wanted to start like building lifts into my shoes and doing all these different things. And you can't do an inch and a half lift inside a shoe. It's just there's shoes that work that way. So I've been through so many different things, so many different, foot doctors and
I
trying to
bet.
trying to get this solved. But and I do think I do have about a half inch lift in my shoe right now. And it's probably actually less than that because they always compress down a little bit. But there's something for me. I really need that pressure upward into my arch, and that sets my heel into a better position. And I think that's the biggest piece, because otherwise I get like a lot of tightness in my IT band adductor on that side. That side really functionally, it takes a lot to just keep it mobile. That's really my biggest job with my left side, is just trying to keep mobility so that I don't, because I started out with sciatic pain, a lot of lower back pain. Once you have, sciatic pain and lower back pain, like it's going to work its way up. You're going to have more problems. But, I have figured out a lot of different things, through the help of some brilliant PTs and, some other, I've worked with lots of different kinds of movement people. I know you're a Pilates teacher as well. I started doing Pilates in the 90s before it was being taught very well. Just trying to get information. I just,
Yeah.
that's been a big part of it for me. And I try to deliver that, back to people as well. Anything that I feel like can be a resource to them, which is why I have you on. I feel like there's a lot out there, and everybody has slightly different approaches. And I think sometimes you do have to try different things. And even working with different therapists. Like I happened to find a therapist that when I was living in New York, who worked with dancers, and she picked up on the fact that I just have a ligament laxity issue, just like a lot of her dancers did. And it's true now that I know it, I can sort of see the way my body is. And oddly enough, I never had joint issues when I played sports or anything, but I think the instability that was going on with my spine because of that was the biggest thing. And the way that I was training my body and loading my body and stuff was just causing more and more problems.
Yeah. Yeah. Isn't it funny how, you know, once someone points something out to us, we're just like, oh, yeah.
It was very helpful.
Yeah. Yeah. And that's the way it is for our patients too.
Yeah.
They know
And
something's wrong.
and it's part of the reason why I mean, I try to get my clients to think about kind of having a team around them. And even with my practice, I try to really have a team around me, of people who I think can come at it with a different perspective. Like you and I probably have a lot of things, the way that we do, the way that we think about things, that's very similar because we've studied, fascial trains and done all this work. But at the same time, we still come at things with
Yes.
different set of eyes.
Yeah, exactly. I've listened to a couple of your podcasts, and yeah, it's funny. You're talking about things just like I do, but you're approaching it from a completely different way.
Yeah.
And so it's really fun to hear that.
Yeah. So what tell us about your program then? What how did that, or how long has this been going on, and how did you develop that? Did this come out of the books?
Yeah. So like I said, I published those books about 10 or 12 years ago. And over the years, I've had lots of people request Skype sessions from
Yeah.
me
Yeah.
uh, to help them, make, fix their pain at home. And so over those years, I've seen what I was missing from my books. And then when I had my own sports and orthopedic clinic, and I saw just a massive volume of people, and I started putting all this together as a patterns of dysfunction, that's when I realized, oh, I can make this a lot simpler. Because in my back pain book, I've got maybe 80 different exercises in there. It's just like, because I was trying to solve every single possible
I
thing,
know. Yeah.
right? And I'm just like, gosh, it doesn't need to be that complicated. It's much
Yeah.
simpler than this. So,
Yeah.
so these home programs, and not only that, but uh, the books are kind of heavy on anatomy and so forth that's causing pain, and then the exercises. Whereas my home programs, I show a little bit of that anatomy, but
Yeah.
really, I found that most people didn't even read my books. They would just jump directly to the exercises.
Yeah.
And then I would get these emails, hey, which exercises should I be doing? And I'm just like, well, didn't you read the book? Well, do I have to? And I'm just like,
Yeah.
they're like this thin.
Yeah.
So it's
Yeah.
not going to take you forever. So I realized that a lot of people don't want to or don't care to know all the ins and outs of things.
Yeah.
And that's why I just created these videos that, oh, that's all you want to know? Okay, here are the exercises that'll solve this pattern of problem. And then I also have taping techniques in there,
Oh, cool.
as well as habit corrections and also the somatics. So I find that taping has been I've developed my own taping approaches to solve certain biomechanical problems in the body. And I use these because our brain is incapable of creating that function because it hasn't had practice creating that function.
Okay.
So taping something temporarily bridges that gap, and it lets people see instantly, oh, wow, I feel a lot better with this tape on. Okay, that's what we're correcting. We're correcting the system of problems that's causing you to need this tape right here. And then
Yeah.
once you fix that, we're going to wean you from this tape.
I haven't studied taping. Can you explain how it helps the system? I mean, is there like a
Sure.
proprioceptive part of it?
Yeah.
Is there actually some sort of support that it creates?
Yes to it all. So basically, so a lot of people, when I talk about taping, they're probably envisioning the kinesio tape.
Right.
That's all the rage for the last few years,
Yeah.
and that you see on Olympic players. That's not the kind of taping I do at all,
Oh, okay. Okay.
because that taping is more about guiding a movement or maybe trying to activate something to happen or limit something
Right.
subtly from
Yes.
happening. But what I am taping are major movers and shakers in the body that are disrupting function. So
Mm.
a lot of it is like I do a shoulder blade taping, and I do foot taping, knee taping, and shoulder blade taping are the primary areas where I do the taping. Because when was the last time you thought about where your shoulder blade was?
Right.
Right? No, no one thinks it's in the
I
back.
think about it a lot actually, but most
Yeah,
people don't.
but hardly anyone even knows that it's back there,
Right.
right? So how are they going to change something they've never even paid attention to? So that's why I've developed, and I saw the need for the shoulder blade taping. And then the foot taping, well, I'm sorry, we have up to 5 times our body weight passing through our foot. And I found that there's being taught, a lot of people who have a flat foot are taught to lift your arch. by rolling the thighs out. Well, that's going to create all sorts of other problems.
Right.
So what we want to do is we just want to create a change where you don't have to think about it, because you've got enough problems going on in your body, and chances are you thinking about trying to change something, it isn't going to be right, and you're going to cause more problems than what you're solving. So the tape helps us do that passively. So the brain may not be directly saying, oh, I need to control that, because it doesn't know how to control that. But if we fix the whole system that is controlling that and feeding that problem, then the brain knows how to fix that whole system. And the taping is really valuable for the patient, because the patient gets to see literally immediately how good they feel when their body is working the way it's supposed to work. And the tape helps them get there right now.
Yeah. So I've noticed you refer to the brain a lot in terms of like it's kind of oversight.
Yes.
and so I'm curious to hear your perspective on this, because it was my early curiosity in my work. I just started feeling like, I mean, for one thing, I started kind of having this sense that by helping change the person's autonomic response to, the way that they were responding to different kinds of things, even the way that we respond to pain. But, because in my practice, I'm working with people who might have also some hormonal stuff going on, or a lot of overhistamine response. I just find a lot of times for me, I start at that autonomic level, and that's one of the measuring tools that I'm looking at when I start working with people. And sometimes some of it's in my intake, some of it comes through questions. I'm trying to get a sense of how well they feel like they're managing stress in their life. How do they feel about, their work, their relationships, those kinds of things. I find there's a lot of information there about, okay, so this is also like a big part of the struggle that's happening at that nervous system level. And one of the things I think, when people have gone through a period with chronic pain or any chronic health issue, they start to lose the faith that they can actually heal again, which is really what you're kind of talking about, right? That brain's response to whatever this is going on needs to activate properly.
Absolutely. I think of it like a yin yang symbol, right? The brain influences the body influences the brain.
Okay. Yeah.
And so if you influence the body, it will help your mind. And if you influence the mind, it will help your body. So, it's this constant feedback system, right?
Right.
So, yeah, that's basically how I think about it. Yeah. And so what, in some cases, and I have a couple of these cases in my book where I have a technique that I've heard you talk about, activating the parasympathetic nervous system, right?
Yeah. To
reduce the stress level and anxiety, contracture and so forth in the body. Yeah. And so I have a technique to do that. And what that helps me see is, if I do nothing else as a physical therapist, and usually when I do these treatments, I'm not trying to fix anything mechanically. The whole focus is to lower their sympathetic nervous system elevation and increase their parasympathetic. So I'm going to devote one session just to that. And then we get to see what the pain is for the next 24 hours.
Yeah.
Right. And so that tells me how much pain there is due to this nervous system issue.
Right. Yeah.
And more importantly, it tells the patient. So I don't have to try and convince them of anything. They get it immediately.
Yeah.
And so that's an important tool.
Yeah. And it's hard to gauge, for yourself sometimes. I mean, I get people coming in who say like, well, I don't feel stressed. And you can hear in their voice that there's a lot going on there,
Right.
But so with your program, are you kind of, is it movement based? Is it stuff that basically kind of that creates some kind of response in the system? Because I think I've talked about this a few times recently on the podcast about our tendency a lot of times, exercising. We've used exercise a lot of times in the past as a stress management tool, where, running or playing a sport or some of those things, we just kind of feel better afterwards, right? Because we've kind of exerted ourselves, we've gotten all our systems kind of, moving. But when we're in a recovery process, when our body is not, functioning properly, continuing to do that is going to wear the system down. It takes a lot of energy to, keep these tight patterns the way they are. And what people don't realize a lot of times is that by doing something that's a more gentle activity, like just as an example, like Tai Chi or swimming or something, that can actually, be something that actually calms the system rather than, adding load and dynamic and force to the system is just going to kind of push it further and further into that, bad patterning, basically. So I guess my question is to you, is that part of your program then to kind of like build a bunch of these kinds of things in early on as part of like a recovery work? Is that the way you think about it?
Yeah. So it's a good question, and I'm still figuring that out in terms
Okay.
of how to use it in my program. So, for instance, at the beginning, do you know what the pain disability index is? Have you used that?
I don't use that, but I've heard of it. Yeah.
Okay, so basically it's like I think 7 questions, and you answer on a 0 to 10 scale about how painful each activity is. All
Okay.
right. So I have everyone fill that out at the beginning of their program because it gives us an objective number of where their pain is. And so what I'm just figuring out is it's so funny. What I'm just figuring out is that a lot of people who join my program, their belief says, I've got to get stronger to get through this pain.
Right. Yeah.
So they're skipping the things that could actually solve their
The
pain
foundation. Yeah.
and going into that immediately. I have a strength and restoration phase, but that's the last thing
Yeah.
that I have people do once they're pain free. And or they'll start. And so I have basically 3 phases. One is this bonus somatics, which calms down the nervous system and unlocks the body. The second is the pain reduction program. And the third is the strength and restoration. Okay.
Yeah.
So I have almost everyone try to start on the pain reduction, because pain reduction, that's why they're here. But you wouldn't believe how many people just go through the pain reduction once or twice and then go to the strength and restoration.
Yeah.
When I say emphatically, you cannot begin your strength and restoration until you're 75% better. And everyone
Yeah.
just ignores it, right?
Yeah.
So, but now what I'm learning is that I'm not giving enough guidance as to when they should even start the pain reduction program. So what I mentioned, the pain disability index, is when they fill that out, now I've said, if your score is 21 or greater, you start with the bonus somatics lessons to unlock your body. Once you do that for a week, then you can move on to the pain reduction program to start the exercises that will biomechanically correct your issues.
Okay.
And that's where also all the habit changes are, the taping techniques and everything else there. Then once you're 75% better, and you can continue doing the somatics if you want to. And then once you're 75% better, then you get to move to the strength and restoration phase. So we'll see if anyone listens to me on that one.
And can people like pay to have, I mean, because one of the things I feel like is important with this, like they need to do the work that you've outlined for them, and they can continue to use your references, but they also kind of need someone for accountability and a check-in once in a while, right? because for these problems, right? It's like sometimes people just get it in their heads that like, I don't really need this part. I'm not stressed. I need to start, right? So then you have to have these hard conversations once in a while. So is that built into the program in some way?
Yeah. So people can always have an individual session with me, but that gets to be kind of expensive. I mean, the whole reason they're going this route is because they spent thousands of dollars already on things, right?
Yeah.
So, but what I've also created is a coaching option that they can purchase. So everyone gets a free coaching session, and that's a group coaching kind of thing with other people who have bought the program who have questions about how to use the program.
Gotcha.
And so we have that coaching session. But if they want more coaching sessions, they can buy a couple more, they can buy 8 more or whatever of these group calls to get more guidance as they're going along. So people certainly have that option if they would like.
Yeah, that's good.
Yeah.
And
I thought I built it so that no one would need me ever again. I'm realizing that's not likely. So I've had to create these things.
But I think, but the next level of this then is what you're creating with the continuing ed programs, right? Because I think that's what people are going to start needing more of. Is there are a lot of practitioners out there like us, or like in the place where you were, where they're not happy having to only get 20 minutes per per client or per patient, and they want to start doing, more one-on-one stuff on their own or whatever it is, that they're going to want to start doing this stuff. And, eventually you may be able to also support those people who are doing the continuing ed by saying, okay, this would be a good person for you to work with. He does a lot of work with shoulders or whatever the case is, right? That I feel like it's important to have a human for accountability for these kinds of things, even if it costs money. I mean, I try to get people on the front end of when I'm working with them to really, take a month, and I'd like to see people once a week for that first month. I want them to be doing more of the things that they want to be doing and not coming to see me. That's always the goal, and that I can be here for tune-ups or check-ins or whatever needs to go on. But I feel like on the front side of this, if I was going to send somebody to you for your program, I would say you should also plan to talk to him, more than once probably to start out with, because there's going to be things that come up that are, outside of your knowledge base, and you're going to need someone to really kind of coach you through this stuff.
Yeah. I'm learning that is the case. So, so I have created an online training program for health and wellness practitioners,
Yeah.
anyone from coaches to surgeons, which is what you're referencing.
Yeah.
And that offers CEU credits for physical therapists, 30 CEU credits for almost every state.
Okay.
And I offer also, there's a myriad of certifying agencies and licensing programs out there. So I can't possibly get certifications for every single one.
Right.
But I've created a block of information you can just hand to your whatever board and say,
yeah,
this is 30 CEUs in Colorado as a physical therapist here, whatever I need. But my goal with creating that is I'm trying to spread the word about how we can more simply and effectively and quickly solve pain in our patients.
Yeah.
And I believe that it's really like my first graduate of my continuing education course was a personal trainer. That made me so happy because I feel that people are going to personal trainers, Pilates instructors, yoga instructors, massage therapists, coaches before they ever get to someone like me, know?
Yeah.
And so you guys are the first line of attack. Yeah. And I thought, I feel that, gosh, if more people had this information, we could nip chronic pain in the bud, right?
Yeah.
But the second reason is that, yes, I want my people who are buying my home programs, I would love to say, hey, here's a guy in your area who's taken my course and knows everything that I'm teaching, and go see them for that hands-on work that you might need and direction. So I absolutely agree with you. It's good. We're humans. We need help sometimes,
And I do think that there's a shift happening, and some of it has to do with insurance, as you mentioned earlier.
Yeah.
It's just become a very difficult process for this kind of work, especially, where it does take ongoing, sometimes it's manual work, but a lot of times it's just like, coaching people through the process of getting their body to feel, right again, and to get it balanced. And I think there are a lot of people out there who have, I've had about 25,000 session hours, it's a lot of experience. And, I'm not a doctor. I stay in my lane. And as I was saying earlier, I try to find, really talented people or really smart people who have enough experience around me, so that if it's a physical therapist specifically that they need, or if they really need to go see an orthopedist, that I have those contacts. Or, sometimes this is the one thing I think about just going through your stuff is, and what you were kind of mentioning earlier, that, the 80 exercises is probably too many, but the 10 will actually solve a lot for a lot of people, and that the body is really resilient and can bounce back, from all sorts of things. But we need to kind of know where to start. That is the trick.
Correct. And, no one in my clinic, if they had any kind of rib cage on down issue, pain, no one got out of my clinic without learning how to walk correctly.
Mm-hmm. Right.
Because walking is one of those fundamental things that's contributing to all of these dysfunctions.
Yeah.
So, yeah, but that can be taught, online or through videos and things like that. And fortunately, my books are called the Fixing You series, and this is called the Fixing You method. And my belief, even before PT school, was I should be able to solve my pain, right?
Yeah.
Because this person didn't create my pain. I created my pain. And
Right.
so my whole purpose is to help guide people to fix themselves. It's not me fixing you, it's you fixing you. And so I believe that can happen in almost all cases. Yes, we need little nudges here and there, but and fortunately, I feel very fortunate that that was my driving belief going into this, because
Yeah.
it makes it easy to create home programs that can solve pain.
Yeah.
If I was a manual therapist like you, that would be difficult for me to create a home program that can reproduce
Right.
what you're doing.
Part of the reason
Yeah,
I started out as a manual therapist and decided I want to teach movement too, because for one, I was learning it for myself in terms of self-care. And I
yeah,
started feeling like, okay, so I free up the structure. We've gotten things a lot more mobile, but we now this is the opportunity we have to then retrain this body. And
yeah,
I was like, well, if I'm already here and I don't know
yeah.
who to send them to right now, I want to start teaching them. So that's, for me, it's always an empowering piece. Like there's something, because early on when I started working, there was a lot of people who you can sort of tell, like they want a guru, they want someone to tell
Oh
them what
yeah,
all their problems are. And that was never my interest. My interest was like kind of what I was looking for myself, which was I don't want to be thinking about the pain that I'm, I'm paying so much attention to the body because it's screaming at me. I want to do all the things on a regular basis that actually take care of it. I call it prehab exercises, like
yes.
the things that I think would keep us out of having to go through rehab over and over again. Because as we know, like shoulder surgery and recovery is such a long process.
Oh gosh.
When if you, 6 months to a year, whereas if you have, the resource that you can keep going back to with a book or with a video or something, you can, as soon as you start feeling that shoulder stuff pop up again, you can make sure you get back on your exercises. You should really be doing them all the time. But I just went there with my mom last year where I started giving her the exercises. And then a couple of weeks ago, she said, I'm starting to feel the shoulder stuff again. And I said, when was the last time you did your exercises? About a year ago.
All right, yeah,
Right.
yeah,
So she kind of got through it with the exercises and then kind of stopped doing it. So sometimes we do need those reminders. And, the fact that she already had all the resource, she knew what the exercises were. I made videos. It makes it a lot easier down the road. But I think you have to first have the experience of like, yes, I have a program, I can go through this, and by doing this I actually feel better, and that kind of builds this confidence that you can do it again.
yes, exactly. And to speak to your guru thing, I this is the beauty of my approach, is that it takes all of that weight off of me as being the guru to fix you,
Right.
right?
Right.
Because it's you fixing you, not me.
Right.
And
Right.
it's funny because every time in my clinic, someone would say, I feel so much better. What did you do? I said, I didn't do a thing.
Yeah.
You did it.
Right.
And because I always love putting that power back into the
It's
person.
so great.
Yeah. And, I'm not doing anything. They're doing everything. And
Yeah.
that's the beauty of it.
Well, this is great, Rick. Thank you so much for sharing all this. So for anybody who doesn't know what show notes are, you can, on the app that you're listening to right now, you can just scroll down at the end, and I'm going to have links to all Rick's stuff on here. And I have also have all your social media stuff, so should be able
Oh,
to find some more there. I'm sure you probably post some different kinds of things and some other resource there. But yeah, I really appreciate you taking the time to do this.
oh, I've absolutely enjoyed it, Jeremy. And also, I just wanted to let your listeners know that whatever you purchase from me, if you type in Fixing You, all one word, FIXINGYOU, in the coupon code, you'll get 20% off of whatever you
Oh, cool.
purchase. Yeah. So make sure they know that too. I think gosh, I listened to you. You were being interviewed by somebody, and you put it on your own podcast, I
Oh
think
yeah,
recently.
yeah, yeah,
Yeah. And I just thought, I was listening to you. I was just like, gosh, I've got to meet this guy. We've got to have a beer together or something.
Yeah,
Because I just really enjoyed listening to you, how you think about things. We're very similar, and like
yeah,
you said, we just do different things to get there,
yeah.
right? But we think about it the same, and I really feel that that's needed in our healthcare. So
Yeah.
thank you for what you're doing.
Yeah, and thank you, and I think that's a good thing to, for people who, might be. Have a lot of people in healthcare professions listening, just to start thinking about, like, if especially if you're not happy in the place that you are, but you've developed all of this information and resource. I mean, you're inspiring me to start thinking about, I should really put this stuff, down in some way. More than just the podcast. Eventually, I sort of want to do something that's a really simplified version of what I've learned over the years. That is just kind of that entry level stuff that I feel like is the foundation for a lot of things, and it's what I do every day. But I think there are so many practitioners out there that have these skills that sometimes aren't even getting put to use well in the healthcare system. Like their empathetic side is getting put to great use, but sometimes their knowledge base, that they're just not getting enough time to actually put it in there. So they hope maybe your work will also inspire some of that.
Well, gosh, that would be nice because my mission, I really love to solve chronic pain and,
Yeah.
get rid of this. I just think we spend unnecessary dollars and time on this kind of stuff, and it doesn't
Yeah.
have to be that way.
Yeah. It's the number one reason for people going to the emergency room, by the way. If I don't know if you knew that, but back pain is the number one emergency room visit, which is amazing because there's not a lot that can be done in an emergency room.
Yeah,
For,
yeah,
for
you're absolutely right. That's like, no, it's too late.
right. So, well, thanks so much, Rick. Really appreciate it.
My pleasure, Jeremy.
Nice to
Thank
meet.
you. You too.